And because we want to get at those knowledge barriers, if you'll click again, access to those improved benefits actually comes when you engage in our 360-degree health disease management program. So it isn't just, you've got the disease, you need this drug, therefore we're going to make the cost go away. You have to engage. You have to be willing to participate in this program, which we then supplement with things like the 24-hour nurse hotline and health coaching. We have medical alerts that go out to both the physician and the patient. So we're giving them a lot of information that they do have to agree to participate, and that eliminates those knowledge barriers as well. So from a patient's perspective, it's really pretty simple and straightforward. If they are high risk enough, and again, we have a wealth of data, we know where these seriously at-risk members are, we'll actually reach out to them. So we have health outreach specialists that say, hey, did you know that if you'll engage in this program with me, your co-pays go away. You'll be able to get this care that you need, no expense to you. People who don't meet that criteria that have these diseases can still participate. Though what we're trying to do is be administratively efficient and get to the most important, most critical people. When a member agrees to engage, this is they get that value tier benefit, and if they have any family members that are accessing the same types of care, they get that improved benefit as well. We've made it very simple for the employers, so they don't have to change their eligibility or restructure their benefits. You have to remain engaged, or you'll drop. That will go away. And of course, we provide reports and information on that over time. So that's one product. A product says this is about evidence-based medicine. These disease states, we know that if we can give you, fewer financial barriers and we can provide you with education and information, you will do better with your disease, you'll be healthier, and your costs will be lower over time. So that's one offering, but it's not the only offering. What we found great interest in among employers is this idea of incentives in general. So that's an evidence-based incentive, but employers who are really interested in improving health and productivity of their workforce sometimes want to incent other things as well. So this is where the concept of flexible incentives come in. And what that means is, essentially, we work with an employer and say, what is it that you want to incent? Is it completion of the health risk assessment? Is it participation in programs like weight loss and smoking cessation? Is it engagement in our disease management programs? Maybe it's even being a good shopper and paying attention to this lab is a lot more cost effective than this lab. So whatever it is they want to incent, we have a flexible foundation that allows us to tie those member actions to different payouts. It can be money deposited in their account, it can be gift cards, it can be an improved level of benefits, or even less of a monthly contribution toward the cost of their insurance. So this is an emerging concept, related but different from value-based benefit designs. And so then the next thing that's important, a lot of what you saw, frankly, it's the large employers that are really sort of gravitating toward that. That's where the most active interest is. So what we're trying to do is say, how can we take those concepts and turn it into a standard product that a small employer of 40 people might be interested in buying. And so here's one concept that we're working on. What happens under this is sort of that same concept of incentive, but it flows through the benefit in a very meaningful way. So an employer offers a standard plan, and maybe it's not that rich of a plan. It's sort of a good but not very rich plan. If their employees are willing to do certain things, and this isn't based on whether they're healthy or not healthy, it's based on what activities they're willing to participate in. So if they will sign up for some of the Anthem.com services, if they'll complete their health risk assessment, if they'll do programs, they earn points. And when they earn enough points, their benefits overall, not just co-pays for certain conditions, but their overall plan improves. And if they maintain that over time, it stays at that level. If they don't, it drops back down to the basic level. So what is this really doing? It's really saying, hey, I'm your employer, I'm providing you insurance, but I need to know you're willing to do your part too. I don't want you just getting on that conveyor belt. I want you to be an active participant. So this is the kind of thing that's emerging that we think is going to make a real difference. At the end of 2009, it looked at one large employer with 40,000 employees that was using a plan of this type. And what we saw is that over the study period, they improved their compliance with their diabetes medications by 8%. So we moved out of that pack of, what do we say, 50 to 65% up to 70%. So still room to improve, but much better. And likewise, their screenings improved as well. So across all of these recommended screenings and services for diabetics, there was statistically significant improvement. Now, of course, you want to translate that into costs. And there's good news, but I have to say that it wasn't yet statistically significant, and we think that's a matter of how long the program's been in place. When you look to the far right, you see that the trend is very consistent with what you saw earlier, spending more on things like prescriptions and outpatient services, and starting to see reductions in inpatient and ER. But it still was netting out to be about a wash. It wasn't actually producing net savings in that period of time. We expect to see that as they continue the program longer. So I'm going to close with just my thoughts on how policymakers can help. I hope that you're convinced that this is a concept that has merit and is important as we try to improve cost and quality. So what I would say is, as I read the bill, I was encouraged that value-based benefit design was mentioned. You saw the reference earlier. And there's some language in there that talks about a differential in benefits for participation in programs, up to a 30% differential. And that was encouraging to me too, because I think it supports that healthy pledge-like concept that you just saw. So I hope very sincerely that as the rules get promulgated, as the states begin to get engaged in structuring their exchanges, that this flexibility will remain. What I worry most about is that we'll get so constrained with benefit design. And I understand the desire to standardize, to simplify, but if we get put in a box, around benefit design, I really worry that this stuff goes out the window. And we're losing a major lever to try to make sure that we're delivering high quality, affordable health care. So I hope that flexibility will remain. It's important to remember that especially in large group, they want this flexibility, but we need to be able to innovate for those small employers as well, for our standard products, even those offered through the exchange. So just an important concept. And then finally, that issue of MLR is very real. A lot of what enables us to deliver these services requires us to provide these kinds of disease management programs and other things to the member. If those aren't considered when the MLR calculation is sort of defined, there's a risk that some of this begins to go away. So I'll just leave you with that. Creative products such as value-based benefit design and incentives can help improve quality outcomes and control costs, and I hope you've learned something about them. Thanks.